And finally, Tom Gordon from the Herald.
Hello, Health Secretary. You mentioned the testing of care workers and other key workers there, but if we look at today's statistics, it is the fewest number of people tested in a day since the 28th of April, barely a fifth of your capacity. Now, can you explain that? Are you, in fact, squandering a huge amount of your testing capacity? Or did you overestimate the demand, in which case it's a bit of a hollow boast to say you have all this capacity when most of it's redundant?
So, Tom, I don't think it's a hollow boast at all to say we've got the capacity. We've got the capacity. And we are wise to have that capacity based on the planning assumptions that we've made for test and protect. There are two routes by which the capacity is used, and that is the demand-led route, where care workers come forward and they go onto the portal and they book a test. And the other route is that route that we initiate, which is those who are over 70 in our hospital setting, those in ICU, you'll see the number is coming down, those in respiratory wards. There is surveillance testing, and now we have test and protect, where we are asking people who have symptoms of the virus to contact NHS Inform, either on the website or NHS 24 through that phone line, in order to book a test and at the same time isolate. That is central part of test and protect. As the care home testing continues, then the capacity moves up and down depending on where the care home testing is at any one point. But I don't think it is fair to say that we shouldn't say we have testing capacity for 15,500 if that is not being used. We have testing capacity for 15,500, and that is part of us being ready as measures are eased from lockdown to be able to continue to quell the transmission of the virus through test and protect. And that is a really important element. Without test and protect, you cannot control the virus as you ease lockdown measures, and therefore we would be more restricted now, but as we go forward, in any easing that we might decide to take in order to help life return a bit closer to normal. Now, constantly we are looking at that testing capacity, what more can we do with it, and how can we make sure that it is used more effectively in order to help us break the transmission of the virus, but also understand the performance of the virus, if you like, across society in Scotland.